Welcome to UMCC Medical Consultants Connectors, where your health matters to us. A perilymphatic fistula, or PLF, is an abnormal opening. This opening is between your inner ear and middle ear. This opening shouldn't be there. It creates a pathway that isn't supposed to exist. It allows fluid to leak from the inner ear to the middle ear. This fluid is called perilymph. Perilymph is essential for the proper functioning of your ear. The leak disrupts the normal balance and pressure in your ear, which is crucial for hearing and balance. This disruption can cause a range of symptoms, including dizziness, hearing loss, and a feeling of fullness in the ear. PLF is an uncommon condition, but it can significantly impact your quality of life. But it's important to know about. Early diagnosis is key to managing the condition effectively. It helps prevent hearing loss and other long-term issues. It also helps prevent other complications, such as chronic dizziness and balance problems. Think of your inner ear like a delicate seashell. It's filled with fluid that is vital for its function. This fluid helps you hear by transmitting sound waves. A PLF is like a tiny crack in the shell, compromising its integrity. This crack disrupts the fluid, leading to a cascade of issues. It affects your hearing and balance, making everyday activities challenging. A perilymphatic fistula, or PLF, can have many causes. Sometimes it's from head trauma, which can be quite severe. This could be a blow to the head, such as from a sports injury or an accidental fall. It could also be a sudden change in pressure, which can be very uncomfortable. This pressure change might happen during activities like scuba diving or even flying in an airplane. Other times, it's caused by an ear infection, which can lead to complications. Certain medical conditions can also increase the risk of developing a PLF. These include bone disorders and previous ear surgeries, which can weaken the ear's structure. Some people are more prone to PLF due to their genetic makeup. These include those with a family history of ear problems or related conditions. People with connective tissue disorders, like Ehlers-Danlos syndrome, are also at higher risk. Children are more susceptible than adults to developing a PLF. This is because their ear structures are still developing and are more fragile. Imagine your ear like a delicate balloon that can easily be damaged. Certain events, like changes in altitude, can cause too much pressure inside the ear. This excessive pressure can create a hole or fistula in the ear. This is how a perilymphatic fistula, or PLF, can happen, leading to various symptoms and complications. Perilymphatic fistula symptoms vary. They depend on the size and location of the fistula. Some people experience dizziness and vertigo. Others have hearing loss or ringing in the ears, known as tinnitus. Changes in ear pressure, also called oral fullness, are also common. Some people feel like they are underwater. It's crucial to recognize these symptoms early. Seek immediate medical attention if you experience any of them. Early diagnosis increases the chances of successful treatment. It can also prevent permanent hearing damage. If you experience any sudden changes in your hearing or balance, especially after head trauma or pressure changes, see a doctor right away. Section 4. Diagnosis and Treatment. Finding the leak. This section delves into the intricate process of identifying a perilymphatic fistula. Diagnosing a perilymphatic fistula can be challenging and requires a keen eye. This is because its symptoms often mimic those of other common ear conditions, making it difficult to pinpoint. Doctors use a combination of methods to make a diagnosis, ensuring they cover all bases. These include a thorough physical exam of the ear, looking for any signs of abnormality. They may also use hearing tests to check for any hearing loss and balance tests to assess the patient's equilibrium. Sometimes, advanced imaging scans like CT or MRI are necessary to get a clearer picture of the inner ear structures. Treatment options depend on the severity of the fistula and the patient's overall health. Conservative treatment includes bed rest, allowing the body to heal naturally. It also includes avoiding activities that increase ear pressure, such as heavy lifting or straining. In some cases, when conservative treatments are not effective, surgery may be needed to repair the fistula. Finding a PLF is like finding a leak in a pipe. It requires precision and expertise. Doctors use special diagnostic tools and tests to pinpoint the exact location and size of the leak, ensuring accurate treatment. Section 5. Protecting your hearing. Prevention and outlook. While not all perilymphatic fistulas are preventable, there are steps you can take. Protect your head from injury. Wear appropriate headgear during sports. Avoid activities that cause sudden pressure changes like scuba diving. If you have an ear infection, get prompt treatment. With early diagnosis and appropriate treatment, the outlook for perilymphatic fistula is generally positive. Many people experience significant improvement in their symptoms. Some even make a full recovery. Remember, your hearing is precious. Take steps to protect it and seek medical attention if you notice any changes. UMCC, your ultimate medical consultants connectors.